The controversial HIV/AIDS Prevention and Control Bill criminalizes intentional and attempted HIV transmission.
We need to supplement the interventions with an enabling law. Some countries began with registration and then implementation of programs, but then they didn't know what it takes to address HIV/AIDS.
A clause in the bill prescribes a maximum 10 years in jail, a fine of over $1,900 or both for anyone who intentionally transmits HIV/AIDS to another person. And it has been welcomed by many.
If it is not intentional, that is okay. But if it's intentional, then I support the legislators.
I think they would have given them a harder punishment, like life imprisonment.
The bill requires medical workers to disclose the status of HIV-positive people without their consent. Parents, too, will be compelled to reveal their HIV status to their children. Uganda's HIV campaigns over the last decade have emphasized abstinence, being faithful, and condom use. But even with positive public opinion for the new bill, activists say it could discourage people from being tested and treated, or worse still, increase the stigma and discrimination around HIV. A national AIDS indicator survey in 2011 showed HIV prevalence rates at 7.3%, with over 130,000 new infections annually. Lilian Moreko of the International Community of Women Living with HIV and AIDS in East Africa says government should instead provide more services to deal with HIV.
We cannot deal with an epidemic with a law, with a legislation, but we can only deal with the epidemic the way we've been doing it, by scaling up the services. And therefore coming up with a law that has such clauses, for God's sake, we are creating a situation, an environment that is going to be, chaotic. Because how are you going to tell that there was attempted transmission?
Uganda's President Yoweri Museveni has 90 days to sign the bill into law. Ssenyange, CCTV, Kampala.